Hello, my name is Dolly McCartney, and I am an RN to BSN student at the University of Kentucky. This PowerPoint presentation is an overview of my practicum for my nursing practice capstone course, which includes a brief description of my practicum setting, what my learning goals were, and my specific objectives on how they were accomplished. To begin with, my practicum was done at a hospital that is a 227 acute care bed facility. This facility is a major medical referral facility for the region. The unit that I actually did my practicum on was a small cardiovascular intensive care unit. This unit has 9 intensive care beds for post-cardiac procedure patients and 4 telemetry beds. The telemetry beds were used as a step-down beds for their patients that were post-cardiac procedure before they are discharged home. This gives their patients continuity of care. My learning goals were to explore relevant evidence-based practice literature related to therapeutic temperature modulation, or TTM, for post-cardiac arrest patients. I did my research using the hospital library and gathering information from scholarly websites on the internet. Along with my preceptor, I then utilized the evidence-based practice information to help develop new policy and procedure for this project and accompanied my preceptor through the entire process to discover how these policies were approved and implemented. Once the policy was approved, we were given the go-ahead to develop and implement protocol, order the equipment needed, which was the Arctic Sun Hypothermia Management System, and start educating the staff on the new TTM policy, procedure, and the new protocol for post-cardiac arrest patients. Therapeutic temperature modulation is used in post-cardiac arrest patients to lower the body temperature over a 24-hour period with a target temperature of 32 to 36 degrees Celsius and then slowly rewarming the body over the next 24 hours for a total of 48 hours of TTM. This cooling and rewarming is done to help prevent secondary brain injury due to edema. TTN, which incorporates mild hypothermia and maintenance of normal thermia, is standard treatment after cardiac arrest for comatose patients in whom spontaneous circulation has been established. TTM can improve neurological outcomes by 49 to 55% in these patients. If resuscitation efforts fail to restore cerebral blood flow within minutes of cardiac arrest, the brain damage may be irreversible. Even after blood flow is restored, however, secondary brain injury can occur and cerebral edema results from direct tissue injury or blood-brain barrier disruption. Death from brain injury is common after cardiac arrest, but patients is most likely to survive and to have a better neurological outcome when mild hypothermia is implemented. When starting my practicum, getting to know my preceptor and the staff was an easy task. They welcomed me and made me feel a part of their team. One of the first meetings that I attended with my preceptor was a meeting on initiating therapeutic temperature modulation. After the meeting, I discussed this with my preceptor and explained that I had experience with this therapy in the past, and she was more than thrilled to have some of the experience to help her with the process of getting the project going. So this became my learning objectives. My preceptor and I worked closely together to gather the information needed to help develop policy and procedure and to establish the protocol for the staff to follow. Once the policy was approved, we initiated the protocol using the equipment they had available, which were cooling blankets and bear huggers along with refrigerated IV fluids, also used to decrease the body to the desired temperature. The protocol also includes lab draws at specific intervals to monitor electrical light balance and have replacement as needed. Since that time, my preceptor has asked for and gotten approval for purchase of 2 Arctic Sun hypothermia management systems. She and I have also worked with the hospital educator to schedule and educate the staff on the policy and procedure of the new protocol for them to follow. The Arctic Sun representative has been scheduled to meet with the staff and to do some hands-on training with new equipment. I also got to do multiple management tasks with my preceptor, which included staff schedules, monthly staff meetings, annual skills training, and also attended multiple meetings over the course of the semester, all of which have been very enlightening as to what a department manager has to deal with on a daily basis. All in all, this semester has been very productive for both myself and my preceptor. The staff that I've been working with this past week just did their first treatment with the TTM. I wasn't there to participate, but my preceptor stated the staff performed very well with the protocol that they had, but that it needed to be revised. The protocol doesn't state a stopping point for drawing labs. This was just an oversight, and they are fixing it. When I compare what I have learned in my practicum to what I learned in the literature, I would include the following as the most important to compare: staffing issues, core competencies, quality and safety for nurses, culture of safety, teamwork, and strategies to include the patient and patient families in their care. Staffing issues in the literature talks about the nursing shortage, and it seems there is always a nursing shortage no matter what facility I'm working at, and it appears that it's going to only get worse before it gets better. Core measures. These are the standards performance indicators that allow for comparison of quality measures between organizations. My practicum setting is very up to date on core measures and had someone that audited their charts and to ensure they were all completed in a timely manner and completed correctly. Quality and safety is another subject that I particularly paid attention to. The acronym STEEEP explain what needs to be done to help ensure safety for the patient and the nurse. S as in safe, avoiding injuries from the care that is intended to help. T, in a timely manner, there is need to reduce wait and sometimes harmful delays for both the patient and the nurse. Efficient, E is in efficient, avoid waste of any kind, be it equipment, supplies, or energy. E is in equitable, being done non-biased, not having issues with race, religion, or anything, gender, or anything of that nature. Another is E, effective, using scientific knowledge to guide our services, and P is in patient-centered care that is respectful and responsive to patient needs. My practicum area practiced all of these and gave the patients the utmost respect. Culture and safety is described as a culture that combines individual and group values, attitudes, and ways of behaving that identify the commitment to an organization's endeavors towards safety and safe practices. The staff at my practicum were very knowledgeable about these issues and were very committed to the organization. Many of the nurses that I worked with had been there for several years and participated in helping the organization to achieve a high standard of safety. Teamwork, or interprofessional teams, is being pulled to the forefront of nursing. Getting the interprofessional team to work together for the good of the patient outcomes is a priority. I really didn't see much of this in my practicum area. This did concern me. However, my place of employment is very much participating in this aspect of nursing. Each morning the nurses get together with the physicians and other members of the interprofessional teams to discuss what needs to be done to further the care of our patients and to get them healthy and sent home in a timely manner. Strategies to include the patient as partners and patient-centered care. Communication between the nurses, patient, and the patient's family members is essential to safety and a key factor in patient satisfaction. This is something that I was very impressed with. We do walk-in rounds at our facility, but the nurses at my practicum took this to a new level. The complete shift report was done at the bedside with the patient and the patient family. I sometimes noticed that the patient or family would chime in with information that maybe the day shift nurse was unaware of, and it helped the other shift to be aware of these things. In conclusion, I have enjoyed this class this summer, and I have learned a great deal. I hope I have inspired someone to look into therapeutic hypothermia modulation and possibly want to implement this therapy at their place of employment. Thank you.